Natasha, Amanda Hawkins and her husband Tim have 3 beautiful daughters, but their youngest, little Gabriella, she came into the world a little differently. Amanda, concerned about COVID-19, went against her doctor's wishes and made the decision to deliver at home.
All the pain had gone away, and it just felt like pure joy.
Amanda Hawkins is talking about the night of April 21st, when she and her husband Tim, who works at Channel 7 in our creative services department, welcomed baby girl number 3, Gabriella. It was earlier this spring when Amanda started thinking she'd like to deliver at home, a decision only about 1% of American mothers make. On top of the thousands in medical bills they were still paying off from baby number 2, who had a hospital delivery, there was the concern of COVID. When cases started spiking, Amanda says Tim got on board too.
The hospitals here in the Metro Detroit area were just being overwhelmed. He said, I think this is going to happen, and I think we're going to give birth at home.
No midwife, no doula, no doctor.
I had so much faith in God, and I just felt like Jesus was with me the whole time.
Dr. Kurt Wharton with Beaumont Royal Oak has been working in obstetrics for 3 decades and understands every woman's desire to welcome their baby in their own way. But he says delivering at home can be a big risk.
We know from several studies that the risk of home delivery can increase the risk of neurological injury, but the mother incurs risk as well of infection, bleeding, obstructive labor.
Risk increases with babies who are early or late, or if the mother has any underlying health issues. Thankfully for Amanda, Gabriella moved from breech to the correct position during month 7, and Amanda was healthy. Before COVID-19, Beaumont limited visitors to 4 people in the delivery room. Now, in addition to a midwife or a doula, just 1 person is allowed.
We test every woman who's admitted to our labor and delivery unit, and we are able to get those results back in 40 to 90 minutes. And if we find someone is COVID positive, we isolate them in a room for their own protection, the protection of others.
Beaumont's Carmano Center for Natural Childbirth is one way mothers can deliver in a home-like setting, says Dr. Wharton, while still having all the medical expertise and equipment readily available. In Amanda's case, it was a close friend, along with her husband, who assisted.
She jumped off of this couch I'm actually sitting on and leaped over to the room, across the room, onto the bed to catch Gabriella with 1 glove on and 1 hand.
Amanda says she probably wouldn't have gone the at-home route with her first baby, but looking back on Gabriella, now 7 months old, she's happy she did. Now, hospital birth rates at both Beaumont and Henry Ford are down this year compared to last, but Dr. Wharton says that doesn't necessarily indicate that at-home births are on the rise. He pointed out that birth rates in general have been steadily declining for about 4 years now. He said, regardless of the choice a mother makes, it is critical to have those important conversations with your doctor beforehand about your risk factors, because he pointed out that even healthy moms with non-at-risk pregnancies, emergencies can happen, and they can happen quickly. We are happy to report, though, baby Gabriella is now 7 months old. She's happy and healthy. Reporting live this morning, Jen Shantz, 7 Action News.